Okay, guys, well, I'll start the video. We're not going to pause and practice. I'm just going to kind of go right through the video. There is a written test, so any notes you take on this, you can actually use on the test. So pay attention, maybe jot some things down, anything with numbers. So like, you know, how many inches, the rate per minute, you know, 30 to 2, things like that. Just kind of pay attention to.
Not sure if it was good enough, and if the patient didn't survive, I wasn't certain, was it me?
And suddenly he stopped talking to me. I was getting ready to take a blood pressure, and he just stopped, like mid-sentence.
I think 3 years older than me, and he was sprawled out on the front steps of a coffee shop.
Where the medics called, and they were bringing in a guy who was having an acute MI.
It sometimes can be a scary situation. Relax. The training and skills are there for a reason. You know what to do.
It's such a practice thing. Everybody's taken CPR, and you've done it so many times.
It was more like in the moment, and I knew what to do. So I felt confident in my skills.
There's always that moment where you've got to step over your own shadow to let the training and the fundamentals of what you know is important come through.
You never know when you're going to need to use it, and when you do, you don't want to have to stop and think about it.
Things are always changing. American Heart Association helps you stay on top of that.
The American Heart Association training is really focused on providing you with the tools that are needed for a resuscitation.
So learn the rate, listen to what the instructor's saying, and do it well. And then be prepared that it's not going to be like that.
We always need to perform. We always need to do what we're called upon to do, no matter what the situation is.
We coded him. We ran the code. We did CPR. We shocked him, and we got him back.
And very quickly went back into a normal rhythm.
It's the look on his face and talking to his family that I really remember.
It was a good day.
Everybody knew their role, high-quality CPR. A couple weeks later, the gentleman walked into the firehouse and shook our hand and said thank you.
When you realize that this guy was completely, you know, out and his heart wasn't beating, and you just brought him back, that is an amazing feeling.
Those are just a few stories of providers who know the importance of what you're about to learn. Basic life support, or BLS.
On any given day and at any time, you could encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. And with the training you receive today, your actions can give the victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. Cardiac arrest occurs in both men and women, but for demonstration purposes in this course, we will perform CPR on adult male victims.
My husband and I are just checking in today.
No, that's not going to work.
John, what's wrong? Are you okay? John? John! Help! Can someone please help?
Got a person down at Transoceanic counter 24.
Wake up, John, wake up.
Sir, are you okay? Can you hear me?
He was just on his phone and then he fell over. I don't know what happened.
Possible cardiac arrest, medical assistance needed.
What?
1, 2, 3, 4, 5, 6, 7, 8.
I'll get the AED.
10, 11, 12, 13, 14, 15, 16.
Ma'am, I'm gonna need you to move. Is he gonna be okay?
Excuse me? 1, 2, 3, 4, 5, 6, 7, 8.
There's your pocket mask.
Apply pads to victim's bare chest.
I'll attach the AED around your compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Plug in pads.
14, 15, 16, 17, 18. 19.
Analyzing rhythm. Do not touch victim.
Stop compressions. Clear the victim.
Shock advised. Charging. Do not touch victim.
Keep clear.
Press the shock button now. Shock delivered.
Are you okay to
Resume
continue?
chest compression.
Let me know when you need me to take over compressions.
6, 7, 8, 9, 30.
Excuse me. I'll take over compressions. Check the pulse. He's got no pulse. He's not breathing. Started CPR. How long was he down?
About 2 minutes. I started CPR right away. She attached
Touch the pad, start defibrillator.
13, 14, 15.
Did you deliver a shock?
We did deliver one and then more compressions and 2 breaths.
2.
Analyzing rhythm. Do not touch victim.
All right, back up.
Clear the victim for analysis.
No shock advised. Resume chest compression.
Wait, he just moved. We've got an organized rhythm.
I have a pulse. He's breathing.
Let's move him.
Let's get the stretcher. You come with us. We're going to go to the hospital.
Okay, thank you.
First, let's talk about the adult chain of survival. There are 5 links in the chain. It starts with immediate recognition of cardiac arrest and activation of the emergency response system. Then it moves to early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compressions. After that, rapid defibrillation is used. The next link in the chain is effective advanced life support that leads finally to integrated post-cardiac arrest care.
There are slight differences in these links if you're inside the hospital. The first link is surveillance and prevention of cardiac arrest with patient monitoring and assessment by the medical emergency team or rapid response team when a patient's condition is starting to deteriorate. The next link is early activation of the code team, followed by early CPR, early defibrillation, and post-cardiac arrest care. Post-cardiac arrest care may be provided in the cath lab and ICU. And this chain is really a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. We just witnessed the chain of survival in action with the victim seamlessly treated. So now, let's go back and review the links in the chain of survival as they happen.
It's a normal day at the airport. We see the man's wife notice that he's not looking well. After he collapses, she immediately calls for help. A security guard rushes over to help. The guard gets no response or sign of breathing, so he directs a coworker to activate the emergency response system. The chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system.
A rescuer must recognize that the victim is in cardiac arrest based on unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or triple a victim's chance of survival. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult suddenly collapse, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers may provide further instructions and guide the bystander until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The guard immediately begins chest compressions without delay.
The second guard returns with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the victim loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing layperson and healthcare providers to attempt defibrillation safely. As the EMS providers arrive and take over care, they extend the chain to give the victim the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the victim. Once the return of spontaneous circulation, or ROSC, is achieved, the victim is transported to receive post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and on interventions that can improve long-term survival. These 5 links of the chain, immediate recognition of cardiac arrest and activation of the emergency response system, early CPR, rapid defibrillation, effective advanced life support, and integrated post-cardiac arrest care, show the most important actions needed to treat cardiac arrest. Basic life support is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for victims of all ages and practice delivery of these skills both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review the rescue again, pointing out the steps of basic life support as they happen.
You can see the guard scan the scene to assess safety in the terminal, even alerting another officer on his radio. First, he tries to get the victim to respond. Then, he checks the man for breathing by watching for chest rise and fall. He sees no sign of breathing.
Although the guard detects no breathing here, abnormal breaths are common in the first minutes of cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR.
As a lay rescuer, the guard does not check a pulse. Lay rescuers should not check a pulse and should assume that cardiac arrest is present if an adult suddenly collapses or an unresponsive victim is not breathing normally.
We see the guard start CPR by removing the victim's shirt and giving chest compressions. You can see that he places the heel of one hand on the center of the chest just over the lower half of the breastbone. Then, he places the heel of his other hand on top of the first, and he keeps his shoulders right over his hands for leverage, with his elbows straight.
The critical characteristics of adult high-quality CPR are to push hard and fast at a compression rate of 100 to 120 per minute and a depth of at least 2 inches or 5 centimeters. Allow complete chest recoil after each compression and minimize interruptions in compressions to less than 10 seconds. There is some evidence that compressions that are too deep, more than 2.4 inches or 6 centimeters, can increase injuries from CPR. However, most providers do not perform compressions deep enough. You should focus on making sure your compressions are at least 2 inches or 5 centimeters deep. We recommend the use of feedback devices to ensure that your compressions are the correct depth. We'll talk about feedback devices later.
And as you can see, giving compressions requires intense effort. You'll discover this in a few minutes when we practice chest compressions. After the second guard returns with the AED and kit, she first turns on the AED. She then removes the adhesive backing and attaches the pads according to the diagram.
And the compressions are given throughout the process to keep blood flowing to the victim's heart and brain. Once the AED is powered on, it will give audible prompts on what actions to take.
Right here, the AED prompts responders to stop compressions while it analyzes the victim's heart rhythm. It takes just a moment for the AED to advise that a shock is needed. The second guard makes sure nobody is touching the victim so that the electrical current from the AED doesn't transfer to someone else. And then she delivers the shock.
Once the shock is delivered, most AEDs will give a prompt to resume compressions. But if it doesn't, compressions should resume immediately.
The guard initially provided compressions without ventilations because he did not have immediate access to a barrier device such as a pocket mask. Once the AED that included a pocket mask arrived, the guard was able to provide compressions and ventilations while the second rescuer used the AED.
The EMS team has arrived to take over. They use good team dynamics by asking the guard to summarize the history of events and care provided.
The EMS team assesses the victim and confirms that he is still in cardiac arrest, so they resume CPR. Now, ventilations are provided using a bag mask device.
The EMS team attaches their manual defibrillator to the victim. The device used by this team can be set to manual or AED mode. Use of the defibrillator in the manual mode requires advanced training to operate that we won't be covering in this course. In this scenario, the defibrillator is set to AED mode.
The AED advises that no shock is required, and the victim begins to move and breathe. The EMS team identifies an organized rhythm and a pulse.
It's worth mentioning that there are many ways that this scenario could have been different. This scenario shows how an integrated system of care helped to achieve a positive outcome, from the bystander recognizing a problem and getting help, to the lay responder initiating care, to the EMS team arriving, stabilizing, and transporting the victim to the hospital for post-cardiac arrest care.
You never know what situation you'll face or what resources will be accessible. But our goal is that with today's training, you'll have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
To begin training, we'll focus on individual skills that rescuers perform. It's most effective to perform CPR as a team. However, to be an effective team member, you'll need to possess the individual skills of CPR. So we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then tap and shout to determine responsiveness. If there is no response, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the victim's chest, looking for chest rise. Check a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you, the rescuer. Locate the victim's trachea by using 2 or 3 fingers and then slide your fingers into the groove just to one side of the trachea where you can feel the carotid pulse. You can scan for breathing and check a pulse simultaneously to minimize time before first compression. The check for breathing and pulse should take at least 5 but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not definitely feel a pulse, ensure that help is on the way and start chest compressions immediately. In this practice session, you will first check for scene safety. When the scene is safe, approach the victim and tap and shout to determine responsiveness. If the victim does not respond, yell for nearby help and check for breathing and a pulse. If there is no breathing or only gasping and no pulse, ensure that help and an AED are on the way and immediately begin CPR, starting with chest compressions.
We'll pause here before we practice checking for scene safety, responsiveness, breathing, and pulse. So position yourself to the side of your mannequin to practice. The instructor can begin when everyone's ready. So let's begin. We'll start in 3, 2, 1.
Hey, are you okay? Are you okay? Help! Someone help!
I'll just show a little bit of these practice videos. I don't sit there and let them play.
Call for backup and get an AED.
Now let's practice chest compressions. Before we start, you need to make sure the victim is on a firm, flat surface, lying face up. If you need to remove any clothing from the front of the victim's chest, do it quickly.
A bit later in this course, we'll talk about what to do if someone is unresponsive, not breathing, but does have a pulse. But right now, we're assuming you don't feel a pulse, so compressions are needed.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of sudden cardiac arrest, victims will have oxygen remaining in their bloodstream. So starting CPR with chest compressions can pump that oxygenated blood to the victim's brain and heart. After you give compressions, open the victim's airway and deliver breaths. It's important to minimize interruptions in chest compressions to less than 10 seconds. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. Once you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC. You'll need to work with a bare chest, and later you'll attach the AED pads to bare skin.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast.
You can follow along with what's on the screen as you perform the compressions yourself. You'll perform 3 sets of 30 compressions.
And remember, we'll be performing compressions at a rate between 100 and 120 per minute while counting them out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil between each compression. We'll pause here to give everyone time to get into position. Get ready. Here we go. In 3, 2, 1.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7.
So now, let's go through some instruction on the pocket mask, and then we'll practice one rescuer skills with compressions and breaths.
When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with the use of a pocket mask.
Here we saw an example of that. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with the pocket mask is invaluable.
We'll be using the pocket mask for one rescuer activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the victim's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique more closely. Place the mask on the victim's face, using the bridge of the nose as a guide for correct position. Seal the mask against the face by placing the index finger and the thumb of your hand closest to the top of the victim's head, along the edge of the mask. Now place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the victim's lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using the head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the victim's tongue away from the back of the throat, relieving a possible airway obstruction.
Then press the mask down while lifting the jaw to hold the mask tightly against the face and give 2 breaths while watching for chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each with just enough force to produce visible chest rise. Rescuers should avoid excessive ventilation. Pause about 1 second between each breath.
In this practice session, you want to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest rise as you deliver each breath over 1 second.
We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths.
We'll practice 5 sets of 2 breaths along with the video. Get ready. Begin in 3, 2, 1.
Give 2 breaths. Watch for chest rise.
Now let's practice compressions and breaths together using your pocket mask with the one-way valve.
When switching between giving compressions and breaths, limit the time between compression and breath cycles to less than 10 seconds. Make sure the chest rises with each breath, but provide ventilations just to the point of the chest rising. We'll start with assessment and then combine compressions and breaths. We'll be doing 3 sets of 30 compressions with 2 breaths.
We'll pause here to give you a moment to get into position with the mannequins. Here we go. Begin in 3, 2, 1.
Hey, are you okay? Are you okay? Help! Someone help! Call for backup and get an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
'Now we'll see a scenario with rescuers from multiple agencies.
The real challenge in situations like this becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved.
Dispatch, this is Engine 1. We're on the scene.
Copy that, Engine 1. Time is 14:55.
Dispatch, we have one vehicle upright, no signs of damage, no hazards noted. We have 2 victims present, one is still in the vehicle.
Engine 1, one vehicle upright, no hazards noted. 2 victims total, one still in vehicle.
What's his name? Russ. Hey, Russ, can you hear me? No response?
So what happened?
We were driving and my dad started having chest pains. We rolled into a ditch and he just now passed out.
No breathing. No pulse.
This is cardiac, not trauma. He needs CPR right away. Alert the medics that we have a cardiac arrest and get the AED. Got it.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Attach pads to patient's bare chest.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
Jacob, get ready to rotate in for compression.
20, 22, 23, 24, 25,
Analyzing
26,
heart
27,
rhythm.
28,
Do not touch
29,
the patient.
30.
Clear.
Clear.
Shock needed. Charging.
1, 2, 3, 4, 5,
Stay
6,
clear of
7,
patient.
8.
Deliver shock now.
All right, clear everybody. Clear.
Shock delivered.
1, 2,
Resume
3,
CPR.
4, 5,
Start with
6,
compressions.
7, 8, 9, 10, 11, 12. What do we got? 13, 14.
Victim in cardiac arrest when we arrived. No sign of trauma. The daughter says he was having chest pains and went unconscious just before we arrived. We shocked him once and we've been at it for about 3.5 minutes.
Thanks. We'll switch out monitors after the next rhythm check.
Jacob, compress a little more deeply and avoid leaning.
22, 23, 24, 25,
That's better.
26, 27, 28, 29, 30. 1, 2, 3, 4.
Analyzing
5, 6,
heart rhythm.
7,
Do
8,
not touch
9,
the patient.
10,
Clear the patient.
Clear.
Shock needed. Charging.
1, 2,
Stay
3,
clear of
4,
patient.
5,
Deliver
6,
shock
7,
now.
8,
Clear
11.
patient.
Clear.
Press the flashing button now.
Shock.
Shock delivered.
1, 2, 3,
Resume
4, 5,
CPR.
6,
Start
7,
with compressions.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1,
2, 3.
Good job with chest compressions. Keep it up.
6, 7, 8.
We should start an IV. Let's draw.
Hey, I just saw some eye flutter.
Stop compressions. Check the monitor.
We have an organized rhythm.
Let's check the pulse.
We've got a pulse. Hey, Russ. Russ, can you hear me? Come on, Russ. Russ, wake up. Russ. No response.
Is he breathing?
No, I'll continue bagging.
Remember to give one breath every 5 to 6 seconds. I'll start an IV. Let's get a blood pressure. How easy is he to bag?
His ventilation's good.
Let's get ready to transport.
Let's watch this scene again, paying special attention to the use of the AED and providing breaths by using a bag mask device. When the team members arrive, they assess the scene and try to get a response from the victim. The emergency responder takes a few seconds to check for breathing, looking for no breathing or only gasping, and at the same time, attempts to feel for a pulse. Finding no breathing and no pulse, the team alerts the paramedics en route that this is cardiac arrest. The team moves the patient to a hard, flat surface to begin CPR. One rescuer starts compressions while the second delivers ventilations. A third rescuer sets up the AED and begins attaching the pads to the patient.
During compressions, the compressor counts to 30 so that 2 breaths can be given after each set of 30. The AED is attached and signals that it's ready to analyze. This provides an opportunity for the compressor to switch. We need to point out that it's important to know your AED or defibrillator because there are different models, and it's also important to follow your device's prompts. You may have noticed that the compressor took advantage of the time the device was charging to deliver a few crucial compressions.
High-quality CPR and rapid defibrillation are priorities. The emergency responder operating the AED is responsible for clearing all rescuers to allow for rhythm analysis. If a shock is advised, the emergency responder again clears everyone and delivers the shock.
As soon as a shock is delivered, another set of compressions begins with a different rescuer delivering compressions and using a feedback device. Feedback devices can monitor CPR quality regarding rate, depth, and chest recoil, and provide real-time corrective feedback to rescuers. After each set of 30 compressions, the emergency responder delivers 2 breaths, ensuring that the chest rises with each breath.
The paramedic team has arrived. Now, the team leader directs the handoff without any interruption in CPR by providing a summary of events.
Now let's focus on the use of the AED. You'll need to take a moment to familiarize yourself with the type of AED device used in your training class today. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED. Just open the carrying case or the top of the unit and simply power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's chest by using the diagrams on the pads for correct placement.
Turning on
Some
the
AEDs may have adult
actually
and
a test
pediatric
question.
pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the victim's age, use the adult pads. You may also need to plug in the pads for certain models.
Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple and the other on the victim's upper right chest, directly below the collarbone.
After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the victim's rhythm, followed by a prompt to clear the victim. The rescuer should strongly repeat the command to clear, checking visually to be sure that all rescuers and people receive the command. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. The rescuer should again repeat the command to those nearby. Loudly state something like, "Everybody clear?" or simply, "Clear." And visually make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered. Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the voice prompts of the AED. If at any time the AED indicates no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if a victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has two sets of adult pads, you can apply one set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of the pads to the bare skin.
Water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart.
If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump, smaller than a deck of cards. If you see this lump, avoid putting the pad directly over it.
Also, do not place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that model. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on the victim.
Later today, we'll practice the skills of two rescuer CPR. For the two rescuer practice, we'll use the bag mask device. So let's first learn how to use it. The bag mask device consists of a ventilation bag and a face mask, and it comes in a variety of sizes. You can also use supplementary oxygen with the bag mask device.
To begin, position yourself directly above the victim's head. You'll use the EC clamp technique to hold the mask in place.
To do this, place the mask on the victim's face, using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press the edges of the mask to the face. The remaining three fingers of your hand should form an E to tilt the head back, lift the jaw, and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest does not rise with each breath, then you're not providing adequate breaths.
But if this occurs, readjust the mask, reposition the head and neck, and attempt to ventilate. And then, only if necessary, administer a larger amount of air.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, each breath given over 1 second after every set of 30 compressions.
Make sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation or air going into the victim's stomach instead of his or her lungs. Gastric inflation can cause vomiting and possible aspiration. To illustrate these points, let's see that portion of the scenario again. You can see that 2 breaths are delivered. She's watching the chest rise as she delivers the breaths to confirm that they're effective, and they're delivered over a second with just enough volume to make the chest rise.
If you have multiple rescuers, the most effective way to deliver breaths with a bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause chest rise. The first rescuer will use both hands to seal the mask to the patient's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face. And the 3 remaining fingers of each hand will form an E, lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the patient's jaw down and block the airway. Now, it's time to practice the one rescuer bag mask technique so that in a few minutes, we can combine it with compressions to work on a 2 rescuer sequence.
We'll pause here to get into position.
Now that we're ready, let's practice using the bag mask device. Follow the video prompts. Here we go in 3, 2, 1.
Give 2 breaths. Watch for chest rise. Give 2 breaths. Sometimes a cardiac arrest can occur where treatment is delayed, either because of barriers to accessing the patient or the arrest not being witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater his or her chance of survival and recovery. And early CPR has been shown to double or even triple survival from witness sudden cardiac arrest.
So let's take a look at an instance where CPR was delayed.
Hey guys, so this honestly is why our save rate is as low as it is. So they figured that if you have an out-of-hospital cardiac arrest, you've got about 7% chance of making it. And that's mainly because we don't recognize the signs and symptoms and we don't get started on CPR soon enough. So some things to kind of keep in mind, that 5 minutes without oxygen is the point where you start having brain damage. 10 minutes without oxygen is the point of no return. So after 10 minutes, even if we get a heartbeat back, you are basically a vegetable at that point. So the window to save somebody from cardiac arrest is so very small. That's why we don't have very many saves. I've been doing this for 20 years, and I can count on one hand how many people walked out of the hospital. So every one of those people, early CPR was started. Okay, it was witnessed, and CPR got started. That's really why they live. So most of the times though, it's it's grandma who just says, I'm just not feeling very well, I'm gonna go lay down for a little while. And really grandma was having a heart attack and probably had upset stomach, nausea, whatever, since sometimes a heart attack doesn't always present as chest pain. And then grandma went to lay down, and then you come back an hour later and grandma is dead. So this next video is very realistic when it comes to CPR.
Ready for lunch?
I'm not feeling well at all.
What's the matter?
I'm feeling like my stomach is upset. Just really lousy. Maybe I'm coming down with something.
Let me get you some water.
Yeah, I could really use... Ooh, I need to head to the bathroom.
You gonna be okay?
Yeah, I think I overdid it with the gardening this morning. I'll be fine after I wash up.
Sam, you all right? Sam, you've been in there for a long time. Sam! Sam, are you okay? I'll call 911.
Medic 2 respond, medical emergency, 1105 Country Road 59, unconscious male.
Medic 2 responding.
Medic 2, no other units available for backup. We will dispatch another unit when available.
Thank goodness he's inside. The dispatcher asked me to do CPR, but I couldn't do it.
What happened, ma'am?
He wasn't feeling well. He said it was just his stomach. So he was in the bathroom for a while.
Okay, what's his name?
Sam.
When did he say he didn't feel well?
Maybe before lunch, and he went in to wash up in the bathroom.
How long has it been since you found him there?
I don't know, 10 minutes, and I was worried about him. I checked on him, and he wouldn't respond to me, so I dialed 911. Company's in here, to the left.
Hey, Sam, are you okay? No response. He's not breathing. I can't get a pulse. Let's move him to the other room. Let's start CPR.
Attach pads to patient's bare chest.
4, 5, 6, 7, 8, 9, 10, 11.
Plug in pads connector.
14, 15, 16, 17.
Analyzing heart rhythm. Do not touch the patient.
Clear the patient. Clear.
Clear.
No shock advised.
Resume compressions.
1, 2, 3, 4.
We'll switch compressors at the next rhythm check.
10, 11, 12.
Analyzing heart rhythm. Do not touch the patient.
Clear the patient.
I'm clear.
No shock advised.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3. All right, let's recap. We have an unwitnessed cardiac arrest. We've been at CPR for 10 minutes. We've had no shockable heart rhythm at any time. Is there anything else we haven't done?
I think so.
All right, I'll go ahead and contact medical control to let them know the patient's status and await further instructions. Until then, let's continue high-quality CPR.
So you could see there that the series of events guided the two rescuer team providing high-quality CPR. And then their two rescuer actions provided crucial minutes of quality care until advanced life support arrives.
Actually, for many healthcare providers and other rescuers, the two-person or team rescue is a more common occurrence. So let's first look at the roles for two-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. So they basically treat the situation at first as a one rescuer scenario. And the second rescuer is responsible for powering up the AED and attaching the pads.
Now let's review some of the points for two-rescuer BLS.
Rescuer should pause compressions when giving breaths until an advanced airway is in place. And if you're performing CPR without an AED, rescuer should switch roles when fatigued or after every 5 cycles. That's about 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze. This switch should take less than 5 seconds to minimize interruptions in chest compressions.
The rescuer giving breaths should monitor compression rate and depth, watch for complete chest recoil, and give feedback to the compressing rescuer regarding proper technique.
So now you'll be practicing and working as part of a two-rescuer team. For most healthcare providers and other rescuers, a two-person or team rescue is far more common. In two-rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out.
Rescuer number 1 should be positioned at the victim's side, ready to perform chest compressions and count them out loud.
And rescuer number 2 should be positioned at the victim's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for chest rise and avoiding excessive ventilation. Rescuer 2 should also encourage Rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
So let's practice 2 Rescuer BLS. Follow the video footage and prompts as you practice. We'll work on the full sequence from the point of finding the patient until advanced medical help arrives. We'll pause here for you to get into position for our 2 Rescuer practice.
Okay, let's begin in 3, 2, 1.
Hey, are you okay? Are you okay? Call for backup and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2.
It's a wonderful thing to see teamwork move so smoothly.
That collaboration is partly due to the staff knowing BLS and their responsibilities and to them communicating well. It's also due to a team leader giving directions clearly. Successful team dynamics are critical during a resuscitation attempt. The interaction among team members has a profound impact on the effectiveness of each individual's performance as well as the patient's survival. The better you work as a team, the better the potential outcome for your patient. That's why it's so important to understand not just what to do in a resuscitation attempt, but how to communicate and perform as an effective team, regardless of your role as team member or team leader. To appreciate good team dynamics, it helps to understand what happens.
Hey guys, is everybody doing okay, or should we take 5 minutes or a couple minutes?
I'm good.
You do what you gotta do there, Chad.
I'm doing fine, just making sure you guys are all okay. All right, we'll keep going.
When team dynamics fail. Let's watch the following example of poor team dynamics and see if you can spot the areas that need improvement.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
We've got a teenage boy in full arrest here.
8, 9, watch out, watch out. Move him over. All right. Stop. He's still strapped to the cot. All right. Move on 3. Ready? 1, 2, 3.
When we got there, he just said he wasn't feeling very good.
Let's go ahead and hook him up to the monitor.
We need to ventilate.
We've already shocked him twice, once about a minute ago.
1.
We need to get an IV started.
Have you shocked him? 6.
Yeah, last time a minute ago.
James, take over compressions.
11.
I'm fine. I'm fine.
I got it.
James, you need to do continual compressions with a breath every 10 seconds.
No, do 30 and 2. What have you done besides shock?
Just basic life support.
Laura, can you take care of that IV?
Okay.
Who's documenting? Caleb.
I'll get on it.
The scenario you just watched presented some serious communication flaws, the kind of flaws that can derail a resuscitation attempt. Successful teams not only have medical expertise and mastery of resuscitation skills, they also practice good communication skills and adhere to the key elements of effective team dynamics. These elements help teams work together in the most efficient way possible. The American Heart Association has grouped the elements of team dynamics into 3 categories: roles, what to communicate, and how to communicate. Let's review those now, starting with roles. Clear roles and responsibilities should be immediately established. When all team members know their jobs and responsibilities during a resuscitation attempt, the team functions smoothly. The designated team leader should clearly define and delegate tasks according to each team member's area of competence. Every member on the team should know his or her limitations, and the team leader should be aware of them. Team members should ask for assistance and advice early, not when the situation deteriorates. Sometimes a team member or team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you have to correct a colleague before he or she makes a mistake, whether it's a drug, dose, or intervention. The next category is what to communicate. Knowledge sharing is a critical component of effective team performance. Team leaders should ask for good ideas for management and frequently ask for observations from team members about possible oversights. Summarizing information out loud is a good way to maintain an ongoing record of treatment and acts as a way to reevaluate the patient's status, the interventions performed, and the team's progress within the algorithm of care. This technique can also help team members respond to the patient's changing condition. The last category of team dynamics is how to communicate. Closed-loop communication is important for both the team leader and team members. When the team leader gives an order, the team member should confirm that he or she heard and understood the order. The team leader should call people by their names and, if possible, make eye contact to ensure that the team member has understood the order before assigning additional tasks. The team member should tell the team leader when he or she has completed the intervention. Team leaders and members should also use clear messages. Using concise, clear language helps prevent misunderstandings. Speaking in a tone of voice that is loud enough to understand, but also calm and confident, helps keep all team members focused on the task at hand. All team members should display mutual respect and a professional attitude to other team members, regardless of their personal expertise or training. Because emotions can run high during a resuscitation attempt, it's especially important that the team leader speaks in a friendly, controlled voice and avoids shouting or aggression. Not only is it important to know what to do during a cardiac arrest, but it's just as important to know how to work together as a team during an event. Debriefing as a team is an important component of every resuscitation attempt. Such debriefing during and after an attempt helps individual team members perform better, and it may also bring system strengths and deficiencies to light. Implementation of debriefing programs may even improve patient survival after cardiac arrest. Now we'll see the same scenario with everyone using good team dynamics. See if you can spot each key element in use.
Hi, everyone. EMS just called in and said they have a 16-year-old male who arrested in their unit as they were arriving. They're unloading now, and Pam is meeting them in the ambulance bay. She'll ventilate when they arrive. James and Aaron, can you two cycle through chest compressions for the first rounds? James, you're first on compressions, and Aaron, I need you to hook them up to our monitors and defib.
Yeah, I'll start on compressions.
And I'll have monitor and defib.
Okay, good, thanks. Laura, can you take IV and meds?
Yes, I'll take IV and meds.
Kayla, I need you to record.
I'll record.
Great.
Hi, we're a VLS crew with a 16-year-old male here, witnessed cardiac arrest precisely 3 minutes ago. We started compressions, applied our AED, and gave one shock with no RUSC. We then gave a second shock at the 2-minute mark with no change that we could see. He has been easy to bag.
Okay, thank you. Let's move him over at 30. 28, 29, 30. All right, 1, 2, 3.
Okay, Mike, I'll take over compressions.
All right, thank you. Good switch. James and Aaron, you can swap out compressions every 2 minutes or sooner if you get tired. Do we have an IV?
No, I'm working on the IV now.
Laura, if you can't get the next to stick, try an IO.
Okay. I'm recording.
Okay, monitor is attached.
Hold compressions. Do not feel a pulse. He's in PEA. Continue CPR.
Okay, IV is in and flush.
Good.
James, you should provide continuous compressions and I'll give a breath every 8 seconds.
Are you sure? I think it's 30 to 2 until an advanced airway is in.
He's right. Good catch, James. Continue 30 compressions with 2 breaths for now. Kayla, can you provide a summary of the action so far?
We've inserted an IV and attached a monitor.
As you've just seen, Designating team roles and good communication allows for a rapid and orderly response in an emergency situation. Clear direction and effective communication by all team members creates an environment where patients have the best chance of survival. The ideal situation is a team with multiple rescuers to perform all needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. Pediatric cardiac arrest is not as common as adult cardiac arrest, but it can still occur. In adults, cardiac arrest is often cardiac related, but in children and infants,
Hey guys, so any questions with adult CPR? So some of the key points, when do we call 911? If you are by yourselves, let's say grandpa just went unconscious by the deer stand and your phone is in your pickup, you know, that's way down across the field. You need to go and call 911 and then come back to grandpa, okay? Now, of course, if you can delegate, then delegate or use your phone right there. But don't start CPR and then run a mile to get help coming. Go and get help coming right away. Your compression landmark is the lower half of the sternum. You should start compressions. It should take you no more than 10 seconds to start compressions. You should compress at a depth of at least 2 inches, no more than 2.4. So yeah, get out your little measuring ruler when you're doing your compressions. So at least 2 inches. The rate you should be going is 100 to 120. Okay, that's if you're gonna do compressions straight, you should do 100 to 120 in a minute. Okay, so and as we know, there's those goofy songs that we can sing. Okay, when we're doing compressions, there's another one, Bites the Dust, and Staying Alive by the Bee Gees. That's the most common. For you guys that are around little kids, did you know that you can use Baby Shark? Baby Shark, do 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 do, Baby Shark. Yes, you're welcome. Now that's in your brain. For my nerd friends that are in this group, you can use Vader's Imperial March to do your compressions. Ba, 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 ba. So pick a song. It actually really does help. If you can get one of those goofy songs in your head, then you'll know how fast you can go. So 30 compressions, 2 breaths. As I said, no more than 10 seconds to start compressions and no more than 10-second delay. So, you know, when you're switching off or you're gonna use some equipment, it should take no more than 10 seconds before compressions are started again. Now, just some real life stuff here. When somebody first goes down in cardiac arrest, they've got about 3 minutes, if not more, 3 to 5 minutes worth of residual oxygen still in their blood. Okay, it's not like they go into cardiac arrest and all the oxygen is gone. So those first couple of minutes, you can just do compressions. Okay, now if you got the manpower and you can do 30 to 2, that's fine. But honestly, those first few minutes are pretty critical. Get on compressions and don't stop compressions. So when it comes to when you should move somebody, the only time you should move somebody is maybe to the next room if you guys need more room. Otherwise, don't worry about, you know, let's say this person is way in the middle of Walmart, okay? Don't worry about moving them to the front door so the ambulance can get to them easier. Work them right there. We will carry our bags to you. We have everything we need in our bags, okay? So those first few rounds of CPR and AED are critical to that patient. As I said, we have that 5 minutes and then 10 minutes and there's no chance, okay? But in real life, those first 3 rounds are critical. That's really their make or break point. So don't waste the victim's time moving them for EMS convenience, okay? Sure, move them to the next room where there's more room to work, that's fine. But don't worry about, hey, let's get them on a backboard so we can get them ready for the ambulance and that kind of stuff. Those first few rounds are absolutely critical. Work them right there. Otherwise, it's 30-2 whether there's 1 person or 2 people on an adult person. An adult is considered 12 or the onset of puberty and above. So if you have a young person and you see armpit hair, breast development, pubic hair, chest hair, anything like that, facial hair, they are considered an adult. You will do the adult settings. You will use the adult rules. Okay, I will keep going with, we're probably just gonna get through the video today. So we'll move on to children and infants now, unless somebody has some questions. I didn't know about this little chat thing over here. That's cool. I'll keep checking that if you guys have other questions, or shoot me a text.
It is often due to respiratory problems. Next, we'll see an example of cardiac arrest that underscores the fact that sudden cardiac arrest can happen anywhere at any time to anyone.
Hi guys, have a good weekend, Sarah. I'll see you on Monday, Johnny.
Harold, your mom called. She said she's going to be a few minutes late. Harold? Harold? Harold, hey. Hey, buddy, can you hear me? Nurse Helen, I need you to come to room 109. I've got an emergency. A child collapsed. Someone help! I have an emergency! Someone help! I've got an emergency in here! Oh, Helen. Yes? I have a child, Harold. He collapsed. He's just lying there. Did he fall or bump his head? No, not that I saw.
Harold? Harold, can you hear me? Harold. Go to my office and get the AED. It's on the wall in the hallway just outside the office.
911, what's your emergency?
One of our teachers witnessed a student collapse. I'm giving CPR right now.
What's your address?
Edison Elementary, 724 North Walk Drive, room 109.
All right, I've dispatched EMS. While they're on their way, I'll need to ask you a few more questions.
Okay, I have you on speakerphone.
What's the victim's age?
5 or 6.
Is there an AED nearby?
Yes, I sent someone to get it.
Are you able to give compressions and breaths?
I'm giving compressions now, and I'll give breaths as soon as I get the pocket mask from the AED. And the AED is here now. Okay, can you hand me the pocket mask?
Yes.
And can you attach the AED?
Yes.
They're just a few blocks away, so it shouldn't be long.
Good, and best if they take the Harding Street entrance.
Attach pads to victim's bare chest.
Do you know what the cause of the collapse was?
No, he just slumped over.
All right.
Plug in pads.
6, 7, 8, 9, 10.
Analyzing rhythm. Do not touch the victim.
Okay, stay clear.
Shock advised. Charging. Stay clear of victim.
Clear.
Clear.
Press the shock button now. Shock delivered. Resume chest compressions.
I need you to count out loud so I can help you with your compression rate.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You're doing great. They're pulling into the school parking lot.
Four, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17.
Okay, I'll take over, okay?
Okay. Did he fall or injure himself at all? No.
Okay, he's not breathing and there's no pulse. Let's continue CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5.
Dispatch, this is Unit 705. We have confirmed CPR in progress with the child.
12, 13, 14, 15. How long ago did he collapse?
About 4 or 5 minutes ago.
I started with CPR, I think it was 5 or 6
1,
cycles
2,
and 1
3,
shock.
4, 5, 6, 7. Okay, thanks for doing all that. Good job. 12, 13, 14, 15. 1, 2, 3.
It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens.
Fortunately for Harold, there were teachers and staff knowledgeable in basic life support and CPR.
There are some differences with BLS for children. One is the chain of survival.
The pediatric chain of survival begins with the prevention of cardiac arrest, followed by early high-quality CPR. Next comes rapid activation of the emergency response system, followed by effective advanced life support, with the final link being integrated post-cardiac arrest care.
So now, let's see that scene again and review some of the aspects introduced.
Once again, we see a moment where it's unlikely that anybody is thinking about cardiac arrest affecting their lives.
Much less in a group this young.
When the boy collapses, the teacher isn't sure what to do. But even though she's not trained in BLS, her actions highlight one of the few important differences between BLS for adults and BLS for children.
This is one of those differences. If a rescuer witnesses a child's collapse, he or she should first leave him, as Harold's teacher does, to activate the emergency response system and get an AED or a defibrillator. However, if the rescuer does not witness the arrest and is alone, if trained, she would be correct to perform 5 cycles of CPR before leaving Harold to activate the emergency response system.
But when Helen, the school nurse, enters the room, she first examines the room for safety. Then she goes right to Harold and checks for responsiveness, breathing, and a pulse. She has the teacher retrieve the AED from outside her office, and she immediately calls to activate the emergency response system. And because no pulse is present, she starts compressions. In fact, with children and infants who have no pulse or a pulse of less than 60 with signs of poor perfusion despite adequate oxygenation, CPR should be started immediately.
As the nurse continues CPR, she also gives the dispatcher information over the phone that will be relayed to EMS already on their way. And when the teacher returns with the AED and kit, she has the teacher provide the pocket mask from the kit so that she can give breaths, because earlier breaths are a higher priority in the rescue of children than in the rescue of adults.
And it's important to note that delivery of breaths to children requires less volume and force. However, you still need to provide enough air to see the chest rise.
As the teacher is getting the AED attached, the nurse continues with compressions and breaths in the 30-to-2 ratio.
So here we see the shock delivered to Harold. It makes perfect sense for the school AED to have pediatric pads, though not all AEDs do. If there are no pediatric pads available, it's acceptable to use adult pads on a child or infant. Once the shock is advised and delivered, compressions are resumed. If 2 trained rescuers are available, the one rescuer ratio of 30 compressions to 2 breaths would switch to 15 compressions to 2 breaths.
Now the EMS team comes in and assesses the situation. The nurse continues with compressions and breaths until the EMS team is ready. Then they'll continue CPR on site until ROSC is achieved, and they'll transport Harold to the hospital.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First of all, under the American Heart Association BLS guidelines, anyone from age 1 to puberty is considered a child.
Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls.
When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's about 2 inches or 5 centimeters, and the chest must recoil completely between compressions.
Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, as we mentioned in the recap of the previous scenario, if you are a 2-rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
Another difference has to do with when to activate the emergency response system. If you do not witness the arrest and are alone, you should perform 5 cycles of CPR to ensure that the victim's brain is oxygenated before you leave the child to activate the emergency response system.
However, as we saw in the previous scenario, if the arrest is sudden and you witnessed it, leave the child, activate the emergency response system, get the AED, and then return to the child to perform CPR.
So now let's take the BLS for adults that you've learned and apply it with changes to practice BLS for children.
For this session, we will practice 2 rescuer child CPR using a 15-to-2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here to give everyone time to get into position.
So let's count down to compressions and get started with 2 rescuer BLS for children. To stay together, follow the prompts on the screen. Let's go in 3, 2, 1, go.
Hey, are you okay? Are you okay? Call for backup and get an AED.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the huge difference in saving a loved one.
And we never know who a victim might be, regardless of her perceived health or age.
I'd love to see Dr. Edwards today. I've been checking on her every few minutes. She has a fever and an increased rate of breathing. Okay. Oh, half an hour would be great. Okay, thanks. Bye.
Chloe? 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 Chloe, can you hear me? Chloe? Chloe? Chloe, can you hear me? Hi, I have an emergency. I'm at 1819 Redview Lane in Plainfield. Okay, I'm gonna put you on speaker.
What's the emergency?
My daughter, she's not breathing and no pulse.
Okay, I'm sending fire and EMS. Do you know CPR?
Yes, I just started CPR. I'm a nurse practitioner.
Do you know what happened?
My daughter, she's been sick for the last couple of days, and I was just getting ready to take her to the doctor.
And she's how old?
10 months old.
Okay, they're on their way. Can they enter the house?
Yes, the front door is open. Come on, buddy.
Good. I'll stay on the phone with you until they arrive.
Okay.
I need you to count out loud so I can help you with your rate of compressions.
Okay. 1, 2, 3, 4, 5, 17, 18, 19, 20, 21, 22, 23, 24. I'm in here. Help, please. I'm in the living room. 7, 28, 29, 30.
I'll take over compression. Get ready to give breath. No pulse or breathing. Continue CPR.
Dispatch from truck 81.
Dispatch, go ahead.
1,
Update
2,
EMS.
3,
We have confirmed
4, 5,
cardiac
6,
arrest on an infant.
7,
CPR in
8,
progress.
9, 10, 11, 12, 13, 14, 15.
Did you see her collapse?
No, I was on the phone and I looked away for a second and it must have just happened.
5, 6, 7, 8,
Attach
9,
pads to
10,
victim's
11,
bare
12,
chest.
13, 14, 15.
Plug in pads.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Analyzing
1, 2,
rhythm.
3, 4,
Do not touch
5,
the victim.
6.
Clear to analyze.
No shock advised. Resume chest compressions.
Start CPR.
1, 2, 3, 4, 5, 6.
It can feel like a completely different activity to perform rescue on an infant. But essentially, the principles of performing CPR on infants less than a year old are the same as for adults. There are just a few differences, but the differences are significant.
So let's take things in the same order as we did for adult CPR. Right now, we'll talk about the skills for 1 and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse, followed by infant compressions, and then we'll go on to breaths with the bag mask device. Finally, we'll combine those for practicing 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and not breathing or only gasping, send someone to activate the emergency response system and get an AED. Or leave the infant and do it yourself. However, if the infant collapse was not witnessed and there is no response or breathing, check the brachial pulse immediately. Then, if you don't detect a pulse, perform 2 minutes of compressions and ventilations before activating emergency response.
To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, when attempting to feel the pulse, press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 beats per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest, just below the nipple line. But be careful not to press on the bottom of the breastbone. With that correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or about 1.5 inches or 4 centimeters. Deliver compressions at the rate of 100 to 120 per minute. After each compression, allow the chest to recoil completely. As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or about 1.5 inches or 4 centimeters. Allow the chest to completely recoil with each compression. And count out loud as you deliver 30 compressions.
So let's get into position to practice compressions. Okay, let's go in 3, 2, 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Now let's look at the technique for delivering infant breaths with the bag mask device. This is similar to the adult bag mask technique we practiced earlier. Two things to note before you start. One, make sure you have the right size mask so that it isn't too big or too small. And two, remember that chest rise is the most observable sign to determine the effectiveness of your rescue breaths.
First, position yourself directly above the infant's head. You'll use the EC clamp technique that you learned earlier. However, if you tilt or extend an infant's head beyond the neutral position, the infant's airway may become blocked.
Ensure a tight seal between the mask and the infant's face, and squeeze the bag with your other hand to deliver just enough breath over 1 second to make the chest rise. If the chest doesn't rise, then you are not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air.
It's practice time. We'll practice 5 sets of 2 breaths. Deliver each breath over 1 second, deliver just enough breath to make the chest rise, and make sure you have a tight enough seal with the mask on the infant's face.
We'll pause here to give everyone time to get into position. Follow along with the video. Here we go. In 3, 2, 1. Give 2 breaths. Give 2 breaths. Give 2 breaths.
Now it's time to practice 2 rescuer infant CPR. But before we do, let's take note of a couple of differences between 1 and 2 rescuer infant CPR. One difference is the technique for giving compressions regarding your hand and finger placement. When you do 2 rescuer CPR, the person doing compressions should use the 2 thumb encircling hands technique. Here are the steps. Place both thumbs side by side in the center of the infant's chest, on the lower half of the breastbone. There should be no pressure placed on the tip of the breastbone, and your thumbs may overlap in very small infants. Then encircle the infant's chest and support the infant's back with the fingers of both hands. In this position, use both thumbs to depress the breastbone at least 1/3 the depth of the infant's chest, or about 1.5 inches or 4 centimeters.
The other key difference that we've mentioned is the compression to ventilation ratio. As we mentioned before, instead of a 30-to-2 ratio in a 1 rescuer situation, you'll use a ratio of 15 compressions to 2 breaths. So let's practice our compressions and breaths for 2 rescuer infant CPR. As a reminder, make sure your rate is between 100 and 120 compressions per minute. Use the 15-to-2 compression to ventilation ratio because you have 2 rescuers. Make the compressions about 1.5 inches or 4 centimeters deep. Allow the chest to fully recoil with each compression, and count out loud for your partner.
Time to practice infant compressions and breaths. We'll pause here to give you a moment to get into position with the mannequins. Here we go. Begin in 3, 2, 1.
Hey, are you okay? Are you okay? Call for backup and get an AED. There's no breathing and no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3.
There are some differences for the use of an AED for infants and children under 8. Some AEDs can deliver either an adult or child shock dose. The child dose is used in children under 8. If you're using a pediatric capable AED, it will have features allowing a child appropriate shock. But which feature is available depends on the type of AED you're using.
Your AED may also include smaller sized pads that are designed for children under 8 years of age. If it does, use them. If not, use the adult pads while making sure that they don't touch or overlap. However, you should not use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and will likely not be successful. It's better to provide high-quality CPR than attempt to shock an adult victim with child pads. Some AED pads recommend a different pad placement for infants and children, placing one pad on the chest and one pad on the back. Follow the pictures on the pad packages for proper pad placement. In infants under 1 year of age, if defibrillation is needed, a manual defibrillator is preferred. However, as we've mentioned before, this device is quite different from the AED, and it requires special training not included in this course. If a manual defibrillator is not available, an AED with the pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
As we mentioned, a majority of cardiac arrests happen at home. Just as you saw the mother give mouth-to-mouth breaths, you may need to give breaths to a family member or close friend when you're not at work.
So this section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to the victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, the air you breathe into a victim contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen to the victim.
Let's go through the steps to deliver mouth-to-mouth breaths to a victim. Start by holding the victim's airway open with a head tilt chin lift. Pinch the nose closed with your thumb and index finger, using the hand that's on the victim's forehead.
Then take a regular breath and seal your lips around the victim's mouth, creating an airtight seal. Give one breath and blow for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. And if you're unable to ventilate the victim,
So right now, you guys, with everything that's going on, they're not recommending that you do mouth to mouth. And my thought is always no barrier, no breath. So just know that, most of the time cardiac arrest happens in the home. This is somebody you probably know. It's mom and dad, grandma, grandpa. So I'm not saying that you have to not do mouth to mouth, especially if it's somebody you know. You can always use your shirt. Okay, put your shirt over their face, or a handkerchief, or whatever. It will act as at least a filter of some sort. But a stranger on the street, you'll have to make that choice. Just know after about 3 to 5 minutes of compressions, you're just going to be circulating stagnant blood. So you'll have to make a choice if you don't have a barrier device or a pocket mask.
most of what we've covered today has to do with procedures performed if a victim doesn't have a pulse. But another thing to know is what to do if the victim has a pulse but isn't breathing effectively. At this point, rescuers should give breaths without chest compressions. This is known as rescue breathing.
For adults, give one breath every 5 to 6 seconds, or about 10 to 12 breaths per minute. And for rescue breathing given to infants and children, deliver one breath every 3 to 5 seconds, or about 12 to 20 breaths per minute.
and give each breath over 1 second. Also, make sure each breath results in the visible chest rise. And during rescue breathing, you should check the victim's pulse about every 2 minutes. We'll pause here to give everyone time to get into position. Get ready.
Another way to deliver breaths is with an advanced airway. Devices such as a laryngeal mask airway, supraglottic airway device, and endotracheal tube are types of advanced airways that are more secure for providing breaths. These devices help prevent gastric distension and airway obstruction. And placing these devices requires special training that we will not cover in this course, but you should know how to give breaths with an advanced airway in place.
During CPR, when one of these advanced airways is in place, the ratio of compressions to breaths changes. Instead of giving 30 compressions and 2 breaths, you'll perform continual compressions at a rate of 100 to 120 per minute and give 1 breath every 6 seconds for victims of all ages. There are no pauses in compressions to give breaths with an advanced airway. And not pausing compressions allows blood flow to the heart and brain to remain high.
An opioid-associated life-threatening emergency is one condition that might cause a person to stop breathing but still have a pulse. Opioids are medications used primarily for pain relief. In high doses, these medications can cause a person to stop breathing or can even cause death. Naloxone is a medication that can reverse the effects of opioids and may restore normal breathing. Common ways to give naloxone are intravenous, intramuscular, and intranasal. If you suspect an opioid-associated life-threatening emergency in a patient who is unresponsive and not breathing normally but does have a pulse, you should give 1 rescue breath every 5 to 6 seconds in an adult and every 3 to 5 seconds in a child or infant. Then, if your local protocol allows, you may give naloxone. But don't delay breaths to give naloxone. If the patient does not have a pulse, you can give naloxone after starting CPR.
So guys, I want to show you a couple of videos on some CPR. It's really tough when doing CPR. When the person is really heavy, it really does make a big difference trying to move a limp body, okay, that has no muscle tone left. And you'll see in this video how tough it is for this one person to move. So you will actually see compressions, and then you'll actually see the shock from the AED happen. There's really nothing. It's not really not very exciting when the AED shocks. You just kind of move just a little bit. It's not like on the television shows. Okay, I think I'm gonna find it anyway.
Chad, everything we see on TV and in movies is 100% facts, okay?
Right. Yes.
That's how we all learn.
Thank you. Thank you for correcting me.
Yes. I'm here all week, no problem.
Please, he's dying. Please, dear God. Louis, come out here.
Come on. I need help getting him out of the car.
Officer, there's a whiny officer here. Can somebody please help her? She can't get him out.
I need to get him up out of here.
My daughter's on the phone. My daughter's on the phone to help my husband. Calm down and listen to her. Don't hang up.
6:05 a.m. at Route 43. Hey, that's the coordinates we've got. It looks like it should be.
We need to get him up here, man. Come on. I need to get him up here.
I can't lift him. I can't do it.
Okay, one.
I can't.
1, 2, okay, 3.
Okay. Jeff, honey, baby, please. Oh, dear God.
Come on, Chris.
Somebody, please hurry. Oh, dear God.
Back up.
Oh,
Let's get him up here.
Ready? Oh, my God.
Is there anything in the mouth?
No,
nothing in his mouth.
Please save us. Yes. Please save us. Please, dear God. We have 3 police officers. Dear God, Jeff, stay with me, baby. Honey, stay with me. Jeff, please stay with me, oh, dear God. Dear God.
I don't know. They're pumping his chest right now.
Please, Jeff. Oh, dear God. I don't know what's wrong. Honey, baby. You've got to stay with me. Stay with me, baby. Baby, stay with me. He has lupus.
Don't touch him, okay?
Clear of patient. Analyze it
Okay, thank you.
Shock advised. Stay clear of patient.
Don't touch, stay back.
Okay, baby.
We got the AED. We've gotten one.
Let me know if I'm doing things right. Just keep it on the record. I didn't hear what it said right there.
1 minute, 30 seconds until analysis will proceed.
We still got 1:30. We're gonna have to pull him up the hill a little bit more. Okay.
Where are we? Where's the intersection?
This is Franklin and Mount Rushmore Road.
Franklin and Mount Rushmore Road. Dear God.
I tried to start.
Oh my God.
I did it right.
Oh my God.
You did a good job. You did good.
Oh my God. Please help me. Honey, baby. She's breathing. Jeff. Honey, help him.
Yes, ma'am.
Please help him. Calm down. Help him. Oh, dear God. Please. Jeff, honey, stay with me, baby. Please stay with me.
So I'm going to show you guys another one here. And when they talk about the agonal breathing that somebody has, where it almost looks like they're breathing, but they're actually not. It's more just mouth movement.
p.m. midweek on Bondi Beach. A small crowd, gentle surf, perfect conditions.
It's a beautiful day, huh? Oh, sensational.
It's not the time when you'd expect things to go wrong. 5 off-duty lifeguards happen to be taking part in a photo shoot following media interest in Bondi rescue. Amongst them is Hoppo, the boss, and Corey, one of the most experienced lifeguards on the beach. Halfway through the shoot, a dramatic event unfolds right beside them. A man's found floating, lifeless in the surf. His name is Takahiro Ono, an English language student from Tokyo. No one knows what's happened to him or how long he's been in the water.
Right, Mo, no. Someone go and get on the radio. There's a radio on my bike, call for the doofy. Check pulse.
Hoppo can't detect a pulse.
Bagging, come on.
He's not breathing.
Bagging, come on. Bagging.
Tucker is clinically dead.
You grab the nose.
The boys must get his heart beating again and air into his lungs.
It's a male, about 20 years old. They've got him on the bag now. I'll get back to you in the morning. I can't really feel it. Mate.
Danny arrives with the defibrillator as Corey starts CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Get a towel, get a towel. Yeah, I got it.
Tucker still has no pulse.
Stand clear. Stand clear. Stand clear. Ready?
The machine reads Tucker's vital signs.
Do not touch patient. Analyzing rhythm. Check pulse. If no pulse, give CPR. Check pulse. There's no pulse, give CPR.
Almost like a fish out of water.
I can't get one. Start CPR.
The defib doesn't work on Tucker first time. The machine needs time to recharge. Corey continues CPR.
11, 12.
The ambulance has been called. Paramedics are on the way. Just if you need anything else, give us the yell.
Yeah, copy that, Chapo. 12, 13, 14, 15.
The ambulance down.
It's 4 minutes since lifeguards got to Tucker.
1, 2, 3, 4, 5, 6, 7, 8.
The machine needs time to establish whether he has any heart rhythm.
Stand clear. Do not touch patient. Analyzing rhythm.
Tucker's had 2 shocks. He's in spasm. Patients rarely survive if they need more than 3 shocks. Tucker's been clinically dead for at least 4.5 minutes. He has 1 chance left.
I've lost it.
Stand clear.
Stand clear.
Chest rise.
Do not touch patient. Analyzing rhythm.
The 3rd shock has finally had an effect.
Do not touch patient. Analyzing rhythm.
I won't shock again. Try and breathe, it looks like. Still staying clear. Stay clear.
Analyzing rhythm.
Breathing, yeah. It's all right, mate. It's all right.
Pulse. There's no pulse. Give CPR.
Got a faint pulse. He's breathing, mate. It's getting stronger. Take a good pulse. Good pulse here. You've been in the water and you swallowed a lot of water, okay? Stay, just relax, mate. Just relax. We're looking after you, okay? Understand?
So I think in general, the rule is when in doubt, you should start CPR. Okay, if you're ever wondering, geez, should I? Yes. Yeah, there's a something out there that might make you feel a little better, that doing compressions on a heart that is actually beating does not hurt the heart. Okay, yes, you might pop some cartilage or break some ribs, but those heal. Okay, and you are protected by the bystander laws. Okay, so when in doubt, start compressions. Okay, that's why they say no more than 10 seconds. So if somebody isn't breathing, isn't moving, looks like complete hell, and you're wondering if you should start and you can't feel a pulse, yeah, then start. If your compressions wake them up, hey, good job. Okay, start. That's kind of the main thing. So they talked a little bit about the opiates now, since fentanyl is kind of a big thing. And for you guys that maybe you know somebody who's got an opiate problem, or maybe maybe you have an opiate problem, but there's things out there that can be out of our control a little bit, and you can get over-the-counter Narcan. It's in a nasal spray. You can go to a pharmacy and get this. You can have it on hand. You can keep it in your first responder kit. Okay, so Narcan basically will block your opioid receptors. So an opiate is considered a true narcotic. So narcotic means sleep-inducing. So it tells your body to slow your breathing down so you can fall asleep and you can get through painful situations. Obviously, when taken too much, you will stop breathing completely. So basic opiates that are out there, we've all heard of our fentanyl, but there's oxycodone. Any of our heroin is starting to make a comeback. Morphine, Dilaudid, hydrocodone, oxymorphone, or sorry, that's Dilaudid. But there's just so many. Codeine is a type of opiate. So when taken too much, too fast, you'll quit breathing. So the Narcan actually works very, very well, and you can't really overdose somebody on it. So and it won't hurt somebody to give it. So don't be afraid to use the Narcan if that's what you're suspecting. But one thing you have to be kind of careful of is that, and I've actually seen this where somebody gets irritated because you ruin their high by using Narcan. So I'm going to show you guys one more video here.
He doesn't need. He doesn't need milk, dude. He's fucking overdosing. Yo, he's fucking overdosing, dude. Dude's overdosing. I got the kid. I called 911. I called 911. I got him. What do you mean, dog? Yo, come on. Yo, let him get some time to breathe. It takes a minute to get out. Give him some time. Give him some time. He don't need no more. Leave him alone. Step back. He want milk. He don't need milk, dude. Come on, man. What the fuck, dog? What happened? You just almost fucking died, dude. Dude just fucking saved your life. Dude just fuck my shit up. Yo, he just saved your fucking. Dude, what the fuck? He just fucking saved your life. You're a fucking asshole, dude.
Sorry, I still giggle. So yeah, some people can react like that by, when you ruin their high. So you need to be kind of careful for you first responders or you people that are going to carry it and use it. Sometimes it's best to give it and then get out of the way. Maybe stand back. So I think we'll be done for the night with this. We've gotten all the way through. You guys just hold on to your notes. I will hopefully maybe Ashley, you can help me, but I will try and send this. I did record this, so I'll try to send it in an email so you guys can go back and watch it for those of you that didn't get to see the whole thing. And then we'll take the test on Monday. I'll try to figure out how to get that online as well. So right now, guys, is there any questions with anything? Everybody's still with me?
Yeah, I don't think there's any questions.
How do you know?
Well, because nobody's talking. 5 seconds and then move on.
Well, 10 seconds. 10 second
Okay.
rule.
10 seconds then. Start counting.
All right.
I'm more interested in this 300 city buck than questions.
Oh yeah.
I'm trying to click on it, but of course it's on your screen.
So, okay, guys, I'll let you go for tonight, and we will pick this up on Monday. Okie doke. Have a good Thanksgiving.
You too. Thank you.
Bye-bye.
It's weird for them to, some guy to say